Plymouth County ranks third in the state in terms of the number of cases of Lyme disease each year. To combat the problem, the county has hired an entomologist who studies bugs like ticks. PCN's dropped by to learn more.
We were approached by a group of people who had been affected by Lyme disease and by tick-borne illnesses, and they were people who are selectmen and have other positions in other communities, and they were looking to have Plymouth County be part of the solution to this growing problem. Bringing an entomologist in was one small step to growing our program. In our research and developing this position and working closely with folks at Barnstable County and at the state level, it was apparent that Plymouth County is at a very high risk for tick-borne illnesses, specifically Lyme disease, and that it's becoming a public health problem in this area. And through education and just outreach to people in the community, places like Barnstable County with a position like this already have seen their numbers decrease. So again, we're hoping to replicate that in Plymouth. We did a search for our entomologist position. We were lucky enough to hire Blake. I think his background and knowledge is going to be a great resource here in Plymouth County. We already have a wide network of folks that we're collaborating with to make sure that everybody is included in this conversation and to make sure that Blake hits all 27 towns in Plymouth County. It's a large county, but I think that he's ready to go, ready to make sure that everybody's included and that folks get the information they need. As far as we know, this is the only other position of its type in the state of Massachusetts, aside from, again, the Barnstable County program. We are very lucky to have it and have the support of the county commissioners to bring on this resource and to bring Blake into this position.
So my job entails pretty much educating anyone on anything from ants to yellow jackets, essentially. But my primary focus for the time being is on ticks. Ticks are active all year round, and a lot of times people like to think that just because we have a harsh winter, which I hear people are saying we're going to have this year, that hard freeze is what gets rid of ticks, but that's actually not the case. They have the black-legged tick or deer tick has a 2-year life cycle. And so it does survive the winters. But when it comes to Lyme disease, any of those tick-borne diseases, we really are at a hotbed for that kind of activity. The incidence rate for all of Plymouth County is third in Massachusetts, and it's actually over 100 times greater than the national average, which the national average is about 8. So what we're seeing is that this area right here it really is a public health crisis. In addition to just me going out there and delivering information, is we have several other resources available. We've got tick cards, which is essentially a piece of cardboard that people can take home and read on their own time. We're developing a website that people will be able to access online. In addition to that, we have a bunch of different websites that people can view that are already well established. We also have recommendations for tick testing services where people can go ahead and, if they remove a tick, submit that tick and get that tested to see exactly what's inside of it. They'll know what type of tick it is, how long it's been feeding, and have they been exposed to that type of disease that they're concerned about. And they can actually use that when they visit their doctor. So this service is free to anyone that needs it, as frequently as people need it. I'm available, I'm around. You can contact me at my email address or via phone. I don't mind either way.